I told people that I was looking forward to this talk more than any of the others because it's urban, and I wanted to see whether I'm really talking to urban people, and clearly I am, and it's encouraging because some of the other things I've been doing have been out of my comfort zone on rural, and trying to translate this work into a rural context, which is not really my favourite subject, or not the one I've worked on. So I'm going to talk today around sort of four main areas. The first area is very much the global frameworks that we've been developing in WSP, but with many other development partners around how to look at the sanitation service chain. And from that has come this concept of fecal waste flow diagrams. Now, I checked out with Shubhagato and Prakar last week, and I'm allowed to use the word shit in this room. So we all, this is what we do. So we're comfortable with that. So these are really called shit flow diagrams. But because the World Bank doesn't like the word shit, I've been told not to write it. So the euphemism we usually use is SFDs, which means shit flow diagram. So I'm allowed to say SFD, and I write fecal waste flow diagram. So I'm afraid I have to use that word. Then we'll talk about fecal sludge management and improving on-site sanitation, which is a logical extension of the first one. I'll talk a little bit about the experience in Indonesia on community-based decentralized wastewater systems and how that's been going, and some analysis we've done there. And then a recent study, I mean, it's so hot off the press, the World Bank hasn't even stamped it yet, but I've been told the output is approved, on how to utilize sewers to better to include poor communities. And that was a particular driver from East Asia. So it's 25 past, the clock's ticking. Okay, so I think you all know this service chain. The containment, the household toilet, whatever that is, and then for sewerage, very familiar diagram that you'll all know. The household level, the sewerage network, the treatment plants. I'm not sure that it's so commonly understood in terms of fecal sludge management and on-site systems how that chain works, but you still need the same chain. So for urban areas, you basically have a lot of on-site sanitation or latrines or septic tanks, and then you have this chain, which could be through a vacuum truck, primary manual emptying, or small tankers of some description. There's a whole range of possibilities in that primary emptying. So transfer to something, and then get into the treatment plant. This is the idealized situation. Typical rural situation, and what I've been doing in some of the other presentations I've made, is really focusing on safely covering and replacing the latrine in a new location, or the double pit option, which we're quite familiar with. So I haven't gone into detail with that one for this presentation. Then ideally to reuse and disposal. The Millennium Development Goals have only focused on household access to sanitation, and globally we could say that there's been reasonably good progress made in some countries, not so in other countries, but I'm afraid I don't know the statistics on that for India, but I'm sure you do. We're now moving into the post, it's not too I've got a typo there, haven't I? The post-2015 Sustainable Development Goals, and we've a couple of days ago got some more of the documentation through, and it's going to include the chain. So we're moving from focusing at the household level to a much broader framework, which will include the sanitation chain. So now I introduce the shit flow diagram. I'm guessing some of you will be quite familiar with it. Maybe most of you are familiar with it. So on the left-hand side, this is typically, and the way we developed it was working at the city level. But recently we've been applying it at a different national level, state level. So here you have the population, and you define for yourself what that population is. So this is proportional. So in this example, and I think it's Maputo from Mozambique, you have around 20% using water closets into sewers. These are a whole range of on-site facilities, anything. And then you have a small amount of open defecation. So we're going to chart what happens to this waste as it goes across the chain. So here you have the 20% going into sewers, across in the transport chain. Of the on-site facilities, about 40% of it is safely emptied, and about another proportion of it, maybe slightly more, 50%, is unsafely emptied. This is where you're getting at this stage. And this is the burial one. So this has been abandoned, covered when full. But it's safe. It doesn't affect the groundwater. There's no negative consequences. So it goes straight through to the end result. Can I just ask, how many of you have seen these diagrams before? So most, but not all. All right, I'll explain it this time, and then we can go quicker through the other ones. So of the sewerage, some of it is going through, but there's a certain amount of leakage. Of the safe emptying, as it's gone through, some of it, a substantial amount, is being legally dumped in a treatment facility, and a certain amount of that is illegally dumped, going to the environment. But the real issue is coming here with the unsafe emptying. Unsafe emptying, and I think in the case of Maputo, it's mostly manual emptying, and it goes straight into the environment. Mostly there isn't a system to get it through to the treatment. And here you're looking at the sewage. Although it reached the treatment plant, quite a substantial amount of it is not effectively treated. There is a proportion of both the on-site sludge plus the sewage that is effectively treated and gets through to the treatment plant, around 11%, but a substantial amount doesn't. Of the amount that gets to the sludge treatment plant and is legally dumped, some of it is treated, but still at that level, quite a lot of it is lost. So here you have a sense of where the waste is going. So this is why you can see why we call it the fecal waste flow diagram. So here we represent the different stages, sort of, what can I say, parts of the chain and parts of the environment. So this is largely being dumped near to the residential environment, as obviously open defecation is as well. This is going a little bit further away, and it's getting into largely the drainage system, and this is more into the receiving waters, but unsafe. And the end result is, in Maputo, we have around 23% of fecal waste safely treated, around 70% of it not. So the question I always ask, what does this look like in India? Now, last week we were having a discussion internally in the bank with the urban people, and we thought to stimulate the discussion around urban sanitation, we would put this diagram together based on census data for India. This is crude, but this diagram is one that you can use at a fairly crude level to get a discussion going. So we use the census data, and then I think we actually have some, I think Ravi had some treatment plant data. So there were two sources of data. So we actually knew what people were using. We had roughly these proportions, and this is as far as we could get. And we felt this was a constructive way to actually start the discussion of where the focus should be. So very clearly you have here substantial amount of open defecation and discharge, unsafe emptying, though we weren't hazarding a guess where actually that goes to. We felt there was a proportion, looking at the numbers, that is unknown, and maybe it's safely buried, we don't know. And of the treatment, there's certainly a certain amount, of leakage.
That's only 13% open depth. Oh, sorry, this is urban only.
Yeah, actually,
it's only urban. Okay.
This is urban only. We thought for this discussion it was useful to disaggregate it. We actually haven't used it in this diagram before in this way at a national level with a subsector. There should be a line going through here, and I don't know where it's gone. I can't remember what the final figures were. I'll look that up.
12% effectively treated.
12% effectively treated, and then the balance down here.
Is essentially everything down there.
I'm glad you remembered that. And what we have here is quite a lot of unknowns. I mean, this is really hazarding a guess. But we would say probably you could, in most countries, you could get this diagram to within 10% one way or another to get discussion going. So I'll just bring back this diagram, and the question is, where are we usually focusing and where should we be focusing? I've added to it the open defecation issue, which from the previous diagram we know is a substantial issue in India, in urban areas, and interestingly, and one of the motivators for me coming here, the statistics for Indonesia are that it has 13.9% open defecation in urban areas. And for India, the statistic is 13.1%. So in that level, I come here coming from a rather similar situation.
Do you include helicopters in the open defecation?
I do.
Okay.
Not everyone agrees with me.
Okay.
So we have used that open defecation as sort of fixed point open defecation, but
Okay.
that's a deeper conversation. Let me just say globally, and we have looked at 12 cities, globally and certainly in the area I'm familiar with, there's a lot of financing, project, design, regulation focus on sewage collection and treatment and the sewers. So this is the common focus of the effort that goes in. Fecal sludge management globally is very largely neglected. I have every reason to believe so far in India this is largely neglected, and that's what our studies have shown, and my colleagues in the bank have indicated from what they've been doing. So, very common part that's missing is this connection between the house here and the actual sewerage, and that sewer system, the house connection. And this is why I'm going to focus, the third part of my talk is going to be on that. And then this part of individual and shared needs, and this is all related to reducing open defecation. I think there is quite a lot of focus on improving on individual toilets, but a lot of them are so substandard, there still needs to be more attention. And the issue of shared toilets is very controversial. Probably less controversial here, but globally there's a lot of discussion whether they're appropriate. And I see a lot of emails going back and forward about whether shared toilets are improved sanitation or not. But in my view, in urban areas, you can't get away from them. So this is a framework we're working on, and we're trying to figure out what needs attention. And very much our conclusion is this is getting, I won't say too much attention, it's getting most of the attention. So I wanted to just give an example of those frameworks, how they work in practice from a city I'm working in. Balikpapan is about, I think it's about 250,000 people. So those diagrams, the ones I gave you, were constructed from very crude census data. In this case, we actually used Ministry of Health census data, so this is house-by-house census data. And we ourselves did fairly substantial field survey work, a combination of household surveys, but we didn't just believe what the household told us. We actually had a technical surveyor who came and surveyed around 50% of the household. So we were cross-checking what the household told us with what actually was on the ground. I mean, this involved dipsticks opening up the pits, dipsticks, and really measuring out distance to road, distance to the water point, the wells, and everything. So we put together that data and we analysed that, and what was very interesting was our data completely correlated with the Ministry of Health's census data. And to put that in front of a group at local government in which you have the Ministry of Health, the Water Utility, Ministry of Urban Development, all the different ministries together. And for one is, we didn't know that our data was going to correlate with the Ministry of Health, but it did. There was a very high degree of credibility. So here, we've mapped out... What have I... Oh, I think the battery... Oh, no. We've mapped out what is happening along the chain. And when we were collecting our data, we were picking up indicators for these different points along the chain. So this is the matrix which sits behind the diagram. I won't go into it one by one. Anyone who's got any understanding of spreadsheets, it's very simple. So what we actually got at the end was this diagram. So what you can see here, and we introduced some sort of parts that were necessary. There were areas of the city with high groundwater, but areas where there wasn't high groundwater. So at this level here, there's quite a lot of on-site sanitation that's never been emptied, but it's not causing any harm to anyone, and there's no groundwater in those areas. This area here, these ones here, and here, to answer your question, we're including direct discharge. we were finding this is largely where you've got toilets and very high groundwater, so it's an unsafe mechanism. And we established some local criteria of how to measure that. And there again, you have, like Maputo, you have several clear lines where you've got illegal dumping. We did this partly by talking to the pit emptying companies, finding out what was going on. They were remarkably frank, put it like that. It wasn't too hard if you were careful how you approached them to get the answers. And the not emptied work, the streams, it was clear there were some of them were overflowing directly into the drainage system, and some of them were quite safe. The city has also a very small sewage system, which was, well, it's almost insignificant. I mean, a tiny amount of leakage and a tiny amount is getting treated. The treatment plant is very small. They're spending a lot of time and energy looking at extending it, but they're going to extend it from what is 1% to maybe 3%. So it's not going to change the overall picture. And there are several decentralized systems. Again, I'll talk more about that later. So the end result, we have 34% not causing a big problem in various ways, and around 66% of a problem. Now, we sat down with a group of decision makers. There were about 15 of us around the table, and we said, well, we had the diagram on one end, and then we have a sort of working so sticky cloth and bits of card on the other end. So we were trying to map out, this is your situation, what do you do? So we were working between these sort of two diagrams, and this is what they concluded, was this is a high priority. Reducing open defecation, they thought it was doable to get it down to 0, but then the quality of the on-site sanitation was really a big issue. So this was number 1 priority. And number 2 priority was going to be developing and improving their fecal sludge management. This didn't come up in the discussion at all, although the wastewater utility who's responsible for it were in the room. They clearly saw that this is where their focus had to be.
This is with the decision makers, not with the community.
No, not the community at all. No, this was a multi-departmental meeting in the Ministry of Planning. The Ministry of Planning had convened it with the relevant urban stakeholders for the city. Everyone who needed to be there was there. And we'd been working with them with technical assistance over a period of time. So that was an example. So before I wrap up this sort of global part of the story, the way we're seeing it, it's an old challenge. I think everyone in this room to some extent has been working on it. We start with where is the problem and what is the problem, rather than perhaps the supply-driven approach has been technology. Where do we put our sewerage? Where do we need on-site sanitation? We start off analysing the problem. I haven't talked about it yet, but it's really important to disaggregate the citywide picture from the poor neighbourhoods. The situation in the poor neighbourhoods is quite a different story from citywide, and you need to deal with both. I don't believe in standalone pro-poor initiatives. I believe in pro-poor initiatives to be part of the citywide situation. And for Dhaka in Bangladesh, last week our consultants came up with the ship flow diagram for the city of... Sorry, I'm getting passionate and excited. This is what always happens. We came up with a diagram for the whole city, and then we came up with a separate diagram for the city, for the poor neighbourhoods. Now, the city for the diagram is so bad, you couldn't imagine it could be worse in the poor neighbourhoods, but it was. So this is an important part of the way we approach it. Then you focus on what your key challenges are and your work strategies. And then, as in the urban sanitation policy for India, I do know that exists. My colleague Ravi has briefed me over the years, and he came to Indonesia and presented it to us a few years ago. You work on the strategies that will deal with these problems. So I'm going to just now go into a little bit of the East Asia. That was my global bit, trying to make it as relevant as possible. These are the 3 main countries where I work in urban. Indonesia is 250 million, 250 million. Philippines and Vietnam are both countries of around 100 million. So I would equate these countries to something like a state in India. Indonesia being slightly bigger than UP, and I think the others are, approximately that scale. I put these pictures up just to say to you, the situation is dire, really serious. So we relate. I mean, these are toilets discharging directly into a canal. This is an overhung helicopter latrine. This is a well. I mean, the water is green and slimy. This is a toilet, people washing their face. There's someone cleaning their teeth. Just out of view, you have someone doing the laundry. So, I mean, this is not typical. This is an extreme, but those extremes are not only one city. And this helicopter type of arrangement. These are all very dirty water based, but there's plenty of on-site high groundwater, but they're not so photogenic as these pictures. These are very illustrative. So the typical situation across East Asia is high access to toilets, very little treatment of anything. Indonesia, but the governments are not sitting back. We have a very significant acceleration of urban sanitation program, increased government commitment, and they're very interested in these decentralized community services, and they're scaling them up. Big focus on sludge treatment, and they're planning sewerage. But the capacity is incredibly low, and certainly very low compared to India, because until 2008, 2009, sanitation was a private matter. And it's a totally different story what happened in those years, how it went from a private matter, officially at government level. This is not a government job. And at cabinet, there were comments, why are we talking about this? This is a household issue, even in a city of 12 million. But that has changed, which is wonderful. But you have got a low capacity because of that. Indonesia, Vietnam, very much focusing on sewage treatment and combined. But they do combine drainage sewage systems. They are quite unfamiliar with separated sewage and very much reliant on septic tanks at the household that discharge into the stormwater drain, all of which I believe are situations that you're familiar with. In the Philippines, you have very high on-site sanitation access. They probably moved first on fecal sludge management, and done rather a good job, but only in 3 cities. So they've done a very good job of fecal sludge management in 3 cities, but not much at all elsewhere. And there's almost no investment in sewerage outside of Metro Manila. So let me just dive a little bit deeper now into fecal sludge management. We started in 2011 and in 2012. Well, we started because the government asked us to help them improve how their fecal sludge management treatment works were going. And we said, well, we can't do that because there's no sludge going into them, because there's no chain. And so if you want our help, we're going to look at the whole chain. And they said, well, we want your help. So, all right. And it went on like this. They said treatment works. We said chain. They said treatment works. Where are the design standards? And we said, no, sorry, we can't talk about design standards. We've got to look at the chain. So this dialogue went on. Then there was a sort of watershed meeting in which they said treatment plant, we said chain, and they said, you want us to start saying sanitation chain, don't you? And fecal sludge management. We said, yes. Now, this was 2 years ago. Now they are talking fecal sludge management. And they do it very seriously, and this dialogue is happening. But that was a period of about 4 years of this really interesting dialogue. So our assessment when we started this is our starting point. There is no formal regulation, no responsibility for sludge management. Some for sewerage, some for on-site, but no for sludge management. There are almost no regulations at the national level or local level, and they do exist in a few cities, but the tariff for discharging at the treatment plant is this. No chain, actually, just a tariff. Now, well, you can imagine that tariff discourages anyone from using the treatment plant. So it was a sort of negative regulation. And the result of that, not surprisingly, very low demand for desludging. Though there is an active private sector which tells us that there is some demand. Treatment facilities, they built 120 treatment facilities in the 1990s. Their own assessment says that less than 10 of them are used, and probably only 2 of them are used properly. So they knew this, and that was partly why they were asking us to come in and look at the treatment plants, but their analysis of the problem was, in a sense, the wrong analysis. And huge contamination, surface water and groundwater. I think for Jakarta, it's something like 95% of all wells tested have got high fecal coliform test. So what I've here drawn is a unconnected chain. So our technical assistance was very much around developing the chain, and our approach was, until the chain is in place and it's working, we're not going to even look at the treatment plants. When we see the dialogue on the chain happening and pieces going into place, then we will, and we have now had a little bit of a look at the treatment plants themselves. So ensuring the emptying service is there, the transport is working, that there's accountable payment for it. We are very pro the idea of the private sector taking a role, as long as somebody at the government level is responsible and monitoring that. And the absolute priority is that the septage is safely disposed and treated. It's not hard to get people to get their latrines emptied if they're full. But the question, and then you pay the driver. I think you all know this. You pay the person who takes it away and gets rid of it at the quickest opportunity. So yes, let them continue doing their job, but make sure it goes to the treatment plant. And we found in cities where in many cases the treatment plant was 30, 40 kilometres away. Well, forget it, no one's going to go there. But in many cases it was quite near, it was quite convenient. It still wasn't being used because there was no penalty, there was no consequence whatsoever. Except in one city where actually the local government had been a little bit proactive, and those private sector emptiers were scared to discharge it openly in the drains. Everywhere else it was all, we've got loads of photographs of them doing it. In that city they only did it in the middle of the night. So they would empty in the evening, park the vehicle until no one was looking. So that told us that a bit of proactivity from the local government on this was what was needed. And
if I may, is this regular desludging that is being planned?
Oh no, we haven't got there yet.
Yes.
But that's where we are going now. You're jumping ahead. So these are the sort of issues we've been working with for the last 2 or 3 years. But we really wanted to emphasise, we're doing pilot work, discussions, and then the government convenes a meeting with 300 cities, put them in front of us and says, talk to them. We go, this is very early days, we're just looking at a few cities, we can't, and they just convened this meeting and said, this is going well, talk to them. So our first real message is, every city is different. We are not going to come up with a formula how everyone should do it. The diversity in Indonesia at the national level is on a comparable scale to the diversity in India. Different languages, different cultures, completely different religions, different everything. So in that level there is a similarity. So our checklist to the cities is what is going on now. Work out actually the type of latrines, the septic tanks, what are the issues? What is the demand for emptying? If there is no demand, you've got to actually raise that demand before you put the service in place. In other cities, for all sorts of reasons, the demand is already high. What are the special problem areas? We found a lot of very different types of special problem areas. It could be clay soil. So because of a clay soil, everything fills up very quickly. It could be flooding. It could be topological. It could be a cultural issue. And you must always look in a disaggregated way at the poor areas. Otherwise, you serve the middle class and everyone else, and you won't be serving them. What do they need? Is the private sector active? Where do they dispose? How can you involve them? And responsibility. Who is responsible? Is anyone responsible? Are there any regulations? What do you need? And maybe at this stage, we actually had previous research in which we knew that there was a market for organic compost, but there's no collection. So we had completely a supply of raw material problem before we could even seriously look at how to market this stuff. People are already making organic compost from shit in rural areas, and they're selling it to farmers. So we know, and we've done the religious and sociological research, we know that that can work, but until you collect the stuff, you can't treat it. Another very strong finding is there has to be commitment at the local government, and there has to be a unit that works on this at the local government. This cannot just happen by the private sector and the community. There has to be some sort of institution responsible, but not just for septage management, but for the decentralised systems, for the potential sewerage investment, for the on-site part. And that was completely absent in Indonesia. So there's no responsibility for sanitation at the local level. So this was a recommendation that came out of much broader networks and a much broader research, not only this research, but everything we were doing on urban sanitation came together and said there has to be local government responsibility. Doesn't mean one person has to do it, doesn't mean the private sector can't do it, but there has to be responsibility. So I won't go into detail. At that stage, 3-4 years ago, we came up with a sort of checklist of things you need to get on with. The first one being establish your unit, which was the one I've just mentioned. So all I've got on the right is a lot of this is actually now happening. The ticks, so they've taken it seriously, they're moving ahead. The squares, bullets are more sort of things that we're kind of working on, haven't quite got there yet. So there's a whole lot of steps forward. I mean, the recommendations were very much jointly developed with government, local governments at the local level, and also with the Ministry of Public Works, and it's been a lot of buy-in. The model regulations, they've made very good progress on that one. It's been quite remarkable. We also came up with some medium-term actions, and again, some of those are moving, some of them are not. These things never work in a linear, organised way. So you put all the stuff out there, and it suits them to work on some, and it's a sort of cycle. So we're looking at promoting regular emptying. That bottom point, that one's actually gone very, very quickly in some areas. Several cities have taken that up, including Jakarta. Once that idea came, we got the shit flow diagram for Jakarta there. So sewerage utility got the regulation changed, took responsibility for emptying and fecal sludge management. For whatever political economy reasons, it suited them very well, and that's now already being piloted and is definitely the way they're going to go. Likewise in a couple other cities. I think I'm going to stop on fecal sludge management. If I continue there, I'll never stop. There's a lot more we can... You ask me questions and we'll go deeper. Right. This is a different study. No, I won't get through this because you're going to ask me questions from these other studies and then we're going to get all mixed up. Could you note your questions down as we go through? That will probably be the best thing. This came out of seeing the amount of money that's spent on sewerage and how low the connection rates are and how few outcomes there were from sewerage. I mean, everyone wants to extend the sewerage connections. We're not in any way suggesting sewerage systems, and we're not suggesting in any way they shouldn't, but we want to see outcomes from that investment. So we had dialogues with all the development partners and all the government, the two governments in Philippines, we talked in Philippines, Vietnam and Indonesia, and it was very clear that this was a live, hot topic in Vietnam and in Indonesia, but not in the Philippines. So we decided to go deep and do the survey work in Vietnam and Indonesia only, because we had sewerage projects that were happening that we could influence, or had happened or were about to happen. And in both cases, the government said, yes, do this. Could you give us the results yesterday? And I sat in the Ministry of Construction in Vietnam about a year ago, and they all just said, we want to know this now. And I said, you've got to give us a year. So we've only just wrapped up this project. So if you look at those statistics, lower urbanization in Vietnam, but, heavily urbanizing. So the highest urbanization rate is in Vietnam, although the lowest current urbanization. Improved sanitation, this is household level, it's not sanitation, it's improved toilets, is very high in all of the countries. But look at the septage treatment. You're talking about 4%, 10%, and that 10% in the Philippines is very largely in Metro Manila, where, as I said, they've got their act together. So there's a reason why it's slightly higher in the Philippines. And again, in Vietnam is the one that's taken sewerage a little more seriously and a slightly higher wastewater treatment, but very low in all of them. I actually presented some of this to a group from Bangladesh and India, the World Bank groups, yesterday. Was it yesterday? Monday. Oh, yeah. Time's flying quickly. And the situation in Bangladesh is very, very similar. So this goes back to the same diagram again, the existing focus on the treatment. So in Indonesia and Vietnam, I could say that fecal sludge management, rather than severely neglected, is a work in progress. So that there really is movement, and in future we are heading towards seeing much better outcomes. So this project focused on two areas, only these two areas: increasing connections and improving on-site. And we decided we had to look at both together because we had huge teams in the field doing survey work. It would be foolish to look at one without the other, although they were different areas. So rationale and approach is very much the government wanted it, and the message we got was, we know that there are not many connections, help us go towards a solution. We looked at 12 cities, 6 in Vietnam, 6 in Indonesia, widespread of sizes, locations. The smallest city was 130,000, and the biggest one was Jakarta, which is 10 million, so huge spread. Coastal cities, upland cities, plain cities, variety. We looked at 3 very specific disaggregated areas: areas with existing sewers, areas with planned sewers, and areas where there was on-site sanitation only, and that would go into the future. And we looked very carefully at the differences of those areas. We did a mass of social surveys, technical assessments, focus groups, and came up with what's really a high accuracy margin of error. We did our pre-testing, our data collection, our analysis, and I don't think I want to tell you how many consultants we had in the field because it gave me a headache. And we looked very much disaggregated at the citywide situation and the low-income households. So this is a short version of what I did, a very high-level findings from what I presented on Monday. Again, I couldn't go into the level of detail. So the pictures were, so this is the institutional and the technical put together. Institutionally, fragmentation and gaps. Virtually no overlap. The gaps are very much around no one is responsible for this or that. Or national government is doing something, local government has no ownership, no buy-in, even isn't aware of what's happening. Technically, very poor level of construction, very poor level of maintenance. We found that the on-site and sludge management was very largely missing in national documents and at the city level. It's coming in Indonesia at the national level, but it's not in any way joined up and isn't translating yet into what is happening at the city level. Fragmentation and gaps I've already mentioned. Maybe someone is responsible for this bit or that bit, they never meet together. National government is investing in a treatment plant in that city, the local government has no real buy-in, no one is thinking about connections. Where there were master plans, and there weren't very many, there was extremely poor adherence to them. The master plan is a theoretical document that was produced under this project. Another project was coming in and doing something over here, never really seeing the master plan. In some cases, no one could find them. But in some cases, they did actually follow the master plans and things were built in the right places, but they're very weak or no regulation around connections and on-site sanitation. Lack of quality assurance, I think you are all familiar with what the end result of that is. Very little maintenance is happening. So a lot of what we saw could have been a good system fell into disrepair. And a very perhaps unexpected finding that we didn't say, the government said people won't connect, they don't want to connect. We build these systems for them, they don't connect. But what we found is actually that isn't true. They can't connect. And the worst thing of all is sewers that are built way above the level of the household. So there's no, and this is where the thinking and the designs are so unjoined up. Someone has designed the treatment and the main sewerage without ever even thinking at any level about the house connection. I can see a lot of nodding going on here. But it's more than that. It's not only that level question. There's no tertiary sewers in the streets anyway. So how on earth can you connect a household? So it's typically this focus on the main bulk infrastructure, which is the next slide. The finance is spent on the capital infrastructure, not and no thought of the connecting infrastructure. Time and time again, the story we get is local, and I have heard this from development partners who have to remain nameless in Jakarta. No, local government will take care of that. You go into a meeting about this project, local government are not there. And, this is a lack of joined up. So, I think a lot of us have known this for a long time, but we haven't had the evidence. Now, the other side is communities are not interested. They're not part of this. They don't care. But we found that wasn't true either. We found that the communities were motivated, but they had very little information. Where they were motivated and you got information to them in a timely way, it was a different story. So, first point, a bias towards major infrastructure. Poorly used due to the lack of tertiary connections. People are motivated and they're willing to pay, but they're not being helped how they can use their motivation and what it is they should be doing. Oh, there's so many anecdotes I could give you. I mean, the willingness to pay was evidence that the poorer people were more interested in connecting to a sewer than the middle class people. The middle class areas could contain all their waste on site without a problem. The poorer households have got no space to build an on-site system, so they're paying to go to a community toilet, and they're paying more than the local sewerage tariff. So when you say to them, if a pipe came down your street, their reaction is, we could squeeze in a toilet, but we can't squeeze in a treatment on-site septic tank. So we could just connect to that drain out there. Now, this was very much news to the Ministry of Public Works and the local government, who'd never thought about those terms. So we're finding there, you go out and you speak to people. Look, I'm sure you're not going to be surprised. You find stuff that you don't expect. And when we came back to local government with the evidence and the data, they're going, right, okay, how do we do it? What do we do? We found they wanted, the community want information through their community local leader that they trust and through the local authority. They don't want TV advertisements. They're annoying and frustrating because that's for people out there. They want personalised, they want information through the people that they trust. And they're saying is, and they want it at the right time. Yes, those project people came to see us 3 or 4 years ago. The project then happened years and years later. There's a huge disconnect was happening, and this is connected with the disconnection, the fragmentation of how it's implemented. Very clearly, some householders are completely excluded from project processes. Typically, they're people who are renting. The assumption is the household has control over decisions they're made. So renters and migrants, there's a lot of overlap. A lot of migrants obviously are renters, but also we found when survey work for sewers is happening, it's always the houses along the main roads and who have got easy connection. Houses are also living down lanes behind, and it tends to be the poorer people who'd never have a car, never have a vehicle, who are pushed into the backyards. So a much more difficult situation there. And this is part of what I mentioned about disaggregated information. You've got to get to the bottom of this, and you've got to know this when you're designing. So some recommendations. Again, top-level recommendations, there are far more. These national guidelines have to be integrated. You have to have the whole chain, think chain all the time, and they have to include the on-site part and the fecal sludge management and the connections. National government, but I think in the case of India, this is state government. There has to be an enforcement and a responsibility that local government has to, well, no, perhaps it's national government to state and then state to local. There has to be a chain of responsibility, that those joined up regulations exist at the national level and they cascade down. And they have to check, and I think you've already got the National Urban Sanitation Policy that includes everything. That has to be cascaded down so that state governments are responsible for that, and then local governments to state. And again, we're just starting to develop at the moment the ship flow diagram for the state level in India. That was one of the takeaway from a meeting I was in last week. So that the state governments can look at the ship flow diagram and justify their investment plans based on really solving the problem, not building infrastructure, not just building infrastructure. Capacity building. We found very low capacity at the local level. Well, that's of course logical. If nothing has been done before, you're not going to have capacity sitting there idle. So there has to be a whole lot of capacity building to follow through on the chain. Legal barriers, particularly in Indonesia, there was a very strong perception across the board that you could not possibly subsidize household sanitation. You could only do municipal infrastructure. Vietnam didn't have that problem, but generally this is something that needs to keep an eye on and review. And there needs to be comprehensive manuals, guidelines. Local government said, yeah, sure, we'll do this. We don't know how, we've got no capacity. National government are not helping us. So we went back to national government and said, this is what local government need, and then they turn to us and say, will you do it? We go, no, we can't, we haven't got any capacity either. But this needs to happen at the local level. So those were very much the national level recommendations. At the local level, there has to be a clarification of roles and responsibilities for wastewater and sanitation service delivery. It cannot work unless people know who should do what. There has to be enforcement, promotion of regulations. Those regulations, if they don't exist, can't be enforced, but there has to, and if you've got, particularly around on-site sanitation and sludge management, we just found gaps. Performance assessment, I think, is going too deep. How am I doing for time? Okay, we'll get through. Construction quality is appalling. Regulation, maintenance has to improve. It was very, very poor as well. This all sounds dire, but I have to, if I had more time, I'd say we found good examples in both countries too. And when we had a workshop at the national level, and then we brought all three countries together, we got Indonesia to present its good practices to the Philippines and Vietnam, and we got Vietnam to present its good practices to the other two countries. And so they ended up having a peer-to-peer dialogue, which was much better. They were far more interested in each other than they were in what we had to say. No surprise there. But there were good practices, and we managed to bring that. 5 minutes? I think it's 10. All right, I'm going to flip through. Okay, let me just talk a bit about decentralized wastewater treatment systems. This is a major push of the government for quite a few years now. And what we mean by that is community management, household connections to poor flush, what are they called here, P-trap toilets, with a very, very simple shallow sewer system. And then that is mixed with, and it can include a community sanitation centre, or there may only be a community sanitation centre. So there's three combinations: household connections, community sanitation centres, or both, to wastewater treatment. And we are using mostly anaerobic baffled reactors. That's the main type of technology. And there's a real mix and match between those options, but that's the sequence. The government piloted it in 2003 to 2004 in 7 locations. They liked it so much. They said, this is doable, we can get it into an annual budgeting cycle, we're delivering, it's pro-poor, it's all the right things. So they then went into quite a big scale up, using government funding, relying on some NGOs by 2005 to 2009. And at that point, they decided they were going to go really crazy and implement this across the whole country. They love this much more than conventional sewerage. And it became like a flagship of the government's urban sanitation program. And at the point where they went into this rapid increase, they asked us to come in and do this assessment. And the question was, how are we doing? Actually, we know there's problems. You tell us what you think and how we should improve. They were very open. And the first meeting in the ministry, we were thinking, we know this is bad, it's going to be bad news, and we were quite concerned, and I think they could tell, and they said, forget it, we know all the bad news. You just tell us, you give us an analytical assessment and come with recommendations. What we've got is consultants telling us the bad news, but they don't seem to come up with anything new. Use your international experience to give us some ideas. So our research question was, are community-managed, decentralised systems sustainable? Are they poor inclusive? Are they cost-effective in the situations where centralised sewage or on-site sanitation, they're not feasible or appropriate for some reason? Again, fairly solid research. I didn't put the accuracy I can't remember the margin of accuracy and the errors there, but it was fairly high. We did a lot of field work, and then we used lots of different data sets. We had other information we could correlate with between. Our findings overall. These systems can work very well. In almost all cases, the communities liked them. They were very popular. They kept them clean. Community management is okay for the daily operation. It worked in most places, overwhelmingly most places, but not everywhere. And we got into some serious cultural issues of this. In the parts of Indonesia where community action is part of the culture, they pulled together and they could work at this. Other areas are much more individualistic in their approach, and they're not used to doing things as a community. They think household, and there they were not working half so well. So there was some recommendations. The effluent quality was really pretty good, even above standard, in 80% of the circumstances. But there's no desludging going on, so we are questioning whether, in a few years' time, whether that quality, effluent quality will be so good. I would also ask the question, how much does that matter? But that's another issue, that's an environmental question. Consistently, the community sanitation centres were underutilised. And it was a really interesting story. 50% of the users of the community sanitation centres were previously open defecators. They were people who would have gone to the river, gone into an open space. Because their belief was that a toilet is a horrible thing, a horrible, smelly, nasty thing, why would you want to go there? These things, these community centres were nice and clean. They provided water supply, they provided laundry facilities, bathing facilities, and they were obviously attractive compared to the problems of going to the river. So they started using them. But they liked them so much, they decided to build something in their houses. And then they built something in their houses, and they stuck the pipe out to the river. So we went for a great improvement, and then we went backwards. That was the point at which the government decided to do these combined systems, in which they used the treatment plant from the community system and connected it to the households. And then the other reason for low usage, sorry, I'm going to go through this because I really think it's relevant, was poor site selection. People already had a toilet, but the government had said, you're getting one of these, we're going to put it there. So no one's going to use it. You never go from a private toilet to a shared toilet. You would only go the other way round. And we also found, oh, there's space over there, we'll put it there. Well, it wasn't near enough for people to use it. So site selection is critical. To be effective and useful and to be able to operate them and maintain them, there has to be a high number of users. I suspect in urban Indonesia that's not a problem. In urban India, that's probably not a problem. You're going to have a large number of users if you build them in the right place. We found that the investment costs were really too high where you had low usage rates, too high to be justifiable. We found that the simplified sewers and the combined systems were much more cost effective. The users of the community sanitation centres were going down. The users of the simplified sewers and the combined systems were all going up. So the government shifted instantly its approach to saying we do more household connections, combined systems, and those sort of community networks. The systems could fail completely without government support, and there was none in most of the cities. The communities cannot manage this entire system on their own. I would say never go down that route. And this research got the government to, again, immediately, we coined the term co-management with local government. Before national government had been saying to local government, we will put the capital in, don't you worry, the community will do it. So there was a very hands-off approach, and we found that that was simply not working. And the communities need support, technical issues, non-technical. And as one local government officer said, we can do the technical support, that's easy. It's the community that makes the behaviour change, which is hard. And that's where they felt they weren't equipped to do. There was a very clear division of what the communities can do, what maybe they can do and what they can't do. And so we're saying very clearly, above ground, leave that to the community. They are motivated to keep it clean because it affects them. Don't get local government involved with minor repairs, cleaning, doors, all that sort of thing. But below ground, communities can't do. So this is where local government has to have responsibility at the underground level. Desludging, effluent quality, and we Indonesia is on this ring of fire, and it's earthquakes or volcanoes or tsunamis. There's a lot of issues frequently. I know you're not exempt from that sort of thing either. And in each case where there'd been some sort of disaster, these systems had no one had fixed them up because no one was responsible. Critical factor, I'm nearly through. Critical factors, only put your community sanitation centres in certain situations, and we figured out what those situations were. No space at all ever for household toilets. In challenging environments where there are flooding or subsidence, and households won't build a household toilet because of the ground conditions. They know that they can't. Tenants and casual users, always go for house connections if you possibly can. Optimise size. In our case, we were saying a minimum of 100 households. I actually don't think that's right. I think you can do smaller systems, but you've got to design them smaller. They've got to be designed for the number of users. But there's some serious issues around operation and maintenance costs there. You need to deal with it locally. There has to be co-management with local government for desludging and disposal. And this is where that unit I mentioned to you earlier, this research said you need a unit to manage these systems. And the fecal sludge work said you need a unit. So clearly you need one unit, not 3 or 4 units, and post-disaster. Plan for the city, plan for sanitation services. So DEWATS, as we describe them here, are part of the plan, not the plan. And Indonesia made the mistake of making them the plan. And we said, no, they have to be part of something else. And don't think of them as infrastructure building, which is what they've been doing. They've got to be services. So I think that summarises it very well. And I think this is my last slide. Our conclusion was that these type of systems can be very effective if you build the right type of system in the right place, you optimize the number of users to the design and sustain it, and you share the responsibility between the government and the community. It's part of a plan, and that the community want the system. Finished.